RCT of tooth number 3 under IV sedation. Let's go. Palatal canal pulp came out as whole. This vocal is open. I'm going there, please. Yeah. I'm just gonna leave the GP in there. And then I'm gonna leave it. Not the one. The other case. Yeah.
Doctor.
This dental phobic patient was referred to me for endodontic treatment of tooth number 3. Patient and dentist discussed root canal, trying to save the tooth versus extraction, and patient and the dentist decided that they wanted to try to save this tooth. So patient was referred to me because she has dental phobia and she needs to be sedated. So today went ahead and IV sedated her and did this root canal for her. So take a look. This is subgingival decay, so patient is well aware. She will need a crown lengthening. So you can see old amalgam, recurrence of gingival decay, and partially calcified canals, as you can see. And that's what happens with teeth when there is decay over the pulp chamber, and the canals, they calcify. And that's happened in this case. Also patient's age. This patient is a bit older. And here's the post-op. So take a look. Remove the decay, rebuild the missing walls there. As I said, this tooth will need a crown lengthening. Patient and her dentist are well aware. We IV sedated her and did this, remove the decay, rebuild the missing walls. And take a look, 4 canal systems, MB1, MB2, distal buccal and palatal. I know this dentist, he likes to put posts in teeth, so left post space for him in the palatal canal, as you can see right there, temporize the tooth. Let me show you a different angulation. You can see the MB2 right there, right? Let me show you a different angulation. Take a look at this angulation. MB1, MB2, distal buccal and palatal. Look at all of this anatomy here associated with the MB2 canal. The MB2 canal bifurcates. Okay, so take a look here. Let me show you a different angulation. MB2 is completely separate from MB1. MB1, MB2, distal buccal and palatal. So as you can see, MB2 is separate, completely separate canal, has its own canal. So if you miss the MB2 here, the patient is going to be in pain after the root canal. The tooth will very likely be heat sensitive, perhaps sometimes even cold sensitive, but heat sensitive, and the patient is going to suffer. You left tissue behind. Over time, the tissue will necrose and become infected, and now before you know it, you have a failed root canal. And you wonder why. Well, the reason the root canal failed is because you left pulp tissue behind and microorganisms, and then you'll develop a big lesion here, and patient is in pain and what have you. So locating all the canals, locating all these canals is important. MB1, MB2, sometimes there's an MB3, sometimes there's a DB2. You got to find these canals.